Heidi ho, folks. I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
Together we are those famous physical therapists on the internet.
In our opinion, of course,
That's
Bob.
from The Simpsons. You probably don't know that. So, how to treat your own neck using your own hands. Neck pain, stretches, and relief. We're gonna, you don't need any equipment today. You don't need to buy anything. You don't need to ask for any help from anybody. You can just do it yourself.
At home, at work. You can do it in the car if you're not driving.
This is a good, like, American thing, isn't it?
There you go.
Pull yourself up with your own bootstraps.
There you go.
By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, it's very exciting. You've got to be excited. We are excited. You got to go over to Facebook, and like Bob and Brad, because right now the top post on our page, we're giving away a mattress. It says mattress giveaway.
And this is a high-end deluxe mattress.
I started sleep on it just 3 nights ago. I'm in heaven, Brad. It's a Sleep Ovation mattress. You're going to like it. Take a look. All you got to do is like the post, and then you just got to comment on that post.
Right.
And so
say something nice about us.
Yeah.
Why not? Anyways, Bob, what are we going to talk about?
Okay, we're going to talk about the neck, and we're going to talk about first, you're having pain in the neck, maybe even going into the shoulders a little bit. So we're going to try to find a movement that actually takes away that pain.
Okay.
And you're going to use your hands to help. Okay. So the first one that we do, which people have seen probably a million times if you watch this channel, we do chin tucks.
Oh yes,
right?
I'll do mine this direction.
I'll do it this way. So you're going to start doing the chin tuck. You're not going down. You're not going up. But you're doing a chin tuck. Now,
good posture.
Yeah, very good posture.
Yep,
don't be like this and trying to do it. So, and with that, you're starting to get some movement in the neck. And you're starting to realign the neck to where it should be. But what a lot of times we don't show is after you've done a few of these, and I tend to jump right into these, is I actually do some overpressure using your hands. Now you can do it just taking a couple fingertips and do it gently. Going back, but eventually I actually use the crook of my thumb here, and I actually give it quite a good push. Again, as long as everything has got to be pain-free.
Right. It should feel like a good stretch. You feel a little stretching back in here. Oftentimes, if you got a headache, you can do this, and you can get some relief as well.
Yeah, this is a great one for those neck headaches. I mean, this is the one you want to do if you're doing that. So, all right, you're gonna start with that, and now we're gonna start with one where we often would tell people to use a towel, but hey, you can use your hands.
Right.
So what you're gonna do is you're gonna try neck extension, and a lot of times it's good to be in a chair like Brad is.
Right.
And you're working on starting to extend your neck, and what we're hoping is this starts relieving your pain. If it doesn't, I want you to go ahead and take your hands, and you're going to go ahead and you're going to start a little bit higher up first, where like Brad is. All right, and then you're going to try and do some extensions with that.
If you got a chair with a backrest, go ahead and lean into it so you can relax a little bit more.
Exactly.
And are you going to tell them about pulling the skin a little bit?
Exactly.
I don't want to take your thunder, Bob.
No, take it away. So go ahead and show Brad.
So I'm going to lean back into the chair. I like to do this to get my sleeves to come down, Bob. There you go. You don't have to do that.
He's dramatic.
Anyways,
diva.
I'll start up higher on my hairline here, but that's just me because it feels good there. And then I'll pull, and it's like you're stretching your skin, and at the same time, I'll lean back.
It feels really good, doesn't it?
Oh, yeah. And then I'm going to go down an inch or two and do the same thing. Once again, it should feel good. And I work my way down, and everyone might be a little different on this. You may find it more comfortable just up here.
Again, let pain be your guide. If you want to go back further and further, that's what the hands are hoping to allow you to do. To go, eventually you want to go all the way back. Now, one thing that Brad, can also do, Brad, you can also grab onto the traps like this. I mean, once you get down further, you can. Well, one thing I grab like on C7, C6, right, like.
Well, some people may not know what that is.
So he's grabbing right here right on that bone. Start with that one, Brad.
That knobby bone right at the base of your neck.
Grab on that one and then go back.
Yeah. Now, when Bob says let pain be your guide, what he's saying is it should feel good. You should have a relief with this, along with more range of motion.
Now, it might take you a couple days to get to this point.
Right.
It may be the first day you only can have it, the fingers way up on the neck, and you're just doing some little arcs like this. And you can do these every hour, and you can. That's what's nice. You know, you can be in your office chair or whatever, watching TV, and you can go ahead and do a few of these. And then eventually you can try to work your way down, to the traps, where you're holding the traps and going like this, all the way back.
Now, if you don't have any neck pain or shoulder pain, I would suggest doing it as maintenance, just to keep your neck loose so that you prevent any
It feels
future
great.
pain.
Yeah, there's not a person out there that shouldn't try this.
Right.
Unless you don't have a neck.
Right.
Then I would.
Or, you know, if you had a neck surgery or something
Right,
obvious like that. But
right.
if you're a healthy person with a normal, healthy neck.
All right, in addition to that, we're going to show you one that, again, going back to the headaches, we're going to go ahead and do that.
Oh.
You want to go ahead and do that, Brad? So we can do the spleen massage. So now he's just working, he's working underneath the occiput here, where the neck meets the head. And he's doing little circles, but he can also do spleen, where he puts his two fingers together and pulls them apart. This is just great neck maintenance, especially if you work at a computer or you're putting a lot of stress on your head and neck all day. It's just good to break up that tension and stop the headache from coming before it even shows up. It's good prevention.
Yeah, and you can tell right where the muscles connect to that occiput bone, that junction right in there is a really good place to work that. And you'll know, because it's going to feel like a good release, like all those muscles are going to relax. Take a deep breath with all these. We forgot to mention that, Bob.
Yeah, keep breathing. Want to make sure you're taking nice, relaxed breathing. All right, moving on. For some of you, let's say you're having pain down this side, and you're trying all these things, and it just doesn't seem to be relieving the pain here.
Sure.
Quite often, then, what you may want to try is actually bending toward that side. So you're going to do a chin tuck, and then bend towards that side. I always bring this one up because this is the one that works for me. I get pain here. I tend to, when I do notes and stuff like that, or on the phone, I tend to, crock my head this way. Kink my head, what do I say? Bend my head this way. So I'm actually, in order to treat it, I actually go the opposite direction. But quite often, what works first is going towards the side of pain. But I have found also sometimes, that just doesn't feel good. I can't do it. So I'll take my hand and I'll put it right there on the side of the neck and I'll pull up. I'm kind of pulling in this direction, up towards my eyes. There's a reason we're doing that. That's the way the facets, the joints are oriented. So I'm going to pull up, and now I'm going to bend this way. So I pull up, and now I bend this way. Pull up, now I bend this way. And see if you can get some relief with that.
Yep.
And eventually you want to get to the point where you don't use the hand if you can go all the way over like this. I had a dentist that actually used this, and he was having a lot of pain because I think when he was working on people, he was like this.
Sure, had that.
And this just absolutely took it away. It was just, because he was getting pain all the way down the arm, and it was really actually pretty
Interfering
severe.
with his work.
Yeah.
Yeah.
All right, another one. These are all things you try. You want to see which one helps. The other one is actually rotations with overpressure.
Oh, yes.
Again, very good posture. You're going to work on stretching one direction, stretch the other direction. See, is there one direction that feels better, that actually maybe gives you a little relief? And if that's the case, you might even give it a little overpressure.
Sure.
And you can put a hand here and here and give a little push on the chin.
You're not going to get real aggressive
No.
on this. It's a gentle stretch.
Or you might go the other direction.
And again, up good posture, relaxed breathing. Just
Yep.
relax, let it stretch.
I forgot to mention on the side bending, Brad, too. You can take your fingertips on there, too, and work your into side bending.
Right.
Once it's feeling better,
Right.
it feels like it's the right direction, you give a little bit of extra overpressure that way. So.
And like Bob said, fingertips, don't
Yeah,
take the whole palm and pull. It's very gentle and relaxed.
that big meaty palm of yours.
Ah,
Strong like
I
bull.
am the claw.
So these are things you try. It's all pain-free. Make sure that you're not, causing pain. You want to find the direction that's going to feel better. Use your own fingers, the magic fingers, and hopefully you can find your way to a pain-free life.
Right. There you go.
By the way, we can fix just about anything, Brad, can't we?
Well, just about except for
A broken
there
heart.
you go.
Do you know how complicated that is? That's not a very easy thing to do. So I think we're doing pretty well that we even started it.
What, you mean to put the heart on the screen?
No, to fix a broken heart.
Oh, right, yeah.
Oh.
That's hard
All right,
too.
I think we dilly-dallied long enough.